Dear members of organizing committee and all the participants of Bangladesh International Medical Students Scientific Congress 2020, greetings and welcome. I am Dr. Mehrunnisa Khanom, Associate Professor, Department of Medicine and Head, Division of International Affairs and Research, Chattagram International Medical College, Chittagong, Bangladesh. Please allow me to begin by conveying my heartfelt thanks and congratulations to all those members involved in organizing this great conference and who have been working in front and behind the scene for this great arrangement. So far, I have heard the medical students started organizing this conference since 2015, and this is the fourth time they're organizing this conference and first time ever virtual conference organized by medical students. I myself feel very much honored and privileged to be part of it. So I wish you all the best. And without further delay, I would like to start my session. Mastering the art of communication skill in healthcare. Let's begin with that. Mastering the art of communication in healthcare. According to World Health Organization, there should be 5 attributes of a physician of future generations, having the attributes of a manager, a leader, care provider, decision maker, and most importantly, communicator, all together make 5-star physicians. The objectives of today's session: to understand what is communication, to learn the basic steps of communication in healthcare, and to get encouraged in practicing and applying the knowledge gathered. In the next few minutes, we will be talking about what is communication, what is medium, what is doctor-patient communication, why communication skill teaching is important, what are the components of communication skill, some tips to establish good communication skill, some difficult scenarios, working with the team. We will demonstrate some scenarios and doctor-patient communication skill in COVID-19 era, masking the emotions, strategies of communication in COVID-19 pandemic. Let's move on. Communication is a two-way process by which an information is passed from a sender to a recipient using a medium. A medium is a tool for communication. It can be auditory, visual, print medium, and electronic medium. Doctor-patient communication is the way a physician communicates with patient. The doctor-patient relationship is multi-layered, dynamic, and bilateral. Doctor-patient relationship itself is therapeutic. How? Because excellent communication skills allow a physician to identify a patient's problems rapidly and accurately and provides improved patient satisfaction. Why communication skill teaching is important? Poor communication skill may result in medico-legal vulnerability, patient dissatisfaction, as well as loss of confidence of doctors. And this situation is not very uncommon. This is very important to understand. There are 3 basic components of communication: verbal, non-verbal, and paraverbal. What are those? The content and art of talking is the verbal. The tone, pitch, and pacing means paraverbal. And non-verbal component means attentive gesture, correct posture, eye contact, and active listening. So all types of communications involve these three basic components. A very interesting finding described by Dr. Albert Mehrabian. What we talk to someone, the spoken word or verbal actually contributes only 7%. The voice tone, that is paraverbal, contributes 38%. Most importantly, the body language contributes 55%. So, this is how different types of emojis express our emotions, what you want to talk. So this is very important. It is not only about what is said and what message is received, but also about how it is said, how the body language was used, what was the facial expression. Some tips to establish good communication skill. Yes, for communication, the setting arrangement, it should be a quiet and private place. The physician and patient should sit in a non-confrontational way. The ideal way of placement, there should be a 90-degree angle. You can see here. This is the non-confrontational way of sitting, which is the ideal placement or sitting arrangement for a doctor-patient consultation and communication. There should not be any obstacle like screen, keyboard, and should maintain the same eye level and gain proper eye contact, like here. At the beginning of consultation, you should introduce yourself and anyone else with you in the team, and confirm the name of the person whom you are speaking with. Should start with open questions, and you may write down the facts that are easily forgotten, but writing shouldn't interfere with the consultation. You should check prior understanding of someone who is talking to you, and speak clearly and audibly, should not interrupt, and avoid your own interruptions such as telephone. Try and appear unhurried. Use of silence when appropriate. Yes, silence is golden when it becomes necessary to pause. We will show some videos how we have to pause in between we talk, especially during breaking bad news. Do not use jargons. Non-verbal communication is very important, like smiling, nodding appropriately, and acknowledge the emotions. Be empathic. Yes, empathy means what? Empathy means feeling, having the same feelings of a sufferer. See, this person is having the same feelings of this person, and the same happens to here. So I know exactly how you feel. Empathy is a basic quality that every newborn has, every child has. If one child cries, then another one starts crying, and a series of crying starts. That is the empathy, and we should retain that quality. So, closing the consultation, there should be recapitulation of what has been said. After every consultation, there should be reflection of the key points. Summarization, address any concern, and close the window. There should be smooth closure of the consultation. So we have discussed about setting the arrangement, beginning the arrangement, and the main part or body, including necessary pause, including necessary body language, and closing the consultation. Now we are talking about some difficult scenarios or situations. Patient has language or speech difficulties. We can use an interpreter, but we should address the patient, not the interpreter. It means doctor should look at the patient and interpreter should only translate or interpret. Communicate in writing if the patient can read and write. Sign language can be used, and we can involve someone who is used to communicate with the patient. Yes, regarding personal questions or queries, regarding personal data, regarding examining private parts, we must ensure adequate privacy and adequate confidentiality of patient. That is the patient's right. Patient is too much emotional. What we can do? That is another difficult situation. Encourage the patient to talk, explore the reason for emotion, and set professional boundaries. Yes, you must set professional boundaries if the patient becomes overly familiar. There must be always a professional barrier. Under any circumstances, no discrimination is allowed, so should not discriminate among the patients under any conditions. Working in healthcare is always a teamwork. United we stand, divided we fall. A physician has to work in team with colleagues and other health professionals. Working in team does not change your personal accountability. Try to act as a positive role model. Motivate and inspire your colleagues. Always respect contributions of your colleagues. Communicate effectively, especially during handing over duties. So, this is a transition phase. Let's pause for 5 seconds. Okay, refresh your brains. Now we are going to talk about a scenario as an example of breaking bad news. Here you can see I have shown 2 pictures. One is the ideal scenario, what we used to practice. And the second one is the one customized for COVID pandemic. Because, yes, due to the current requirements of social distancing, wearing PPE, that is the actually customized one. What is bad news? Any news that drastically and negatively alters the listener's view is called bad news. And breaking bad news means disclosure of a bad news to someone. The impact of breaking bad news depends on the size of the gap between the expectation and reality of the situation. It is a complex and sensitive task that requires practice, and a considered, tactful approach. Examples of breaking bad news: you are going to break the news of cancer or any other life-threatening illness, stroke, degenerative conditions, chronic illness, intrauterine fetal loss, death, or anything that is going to adversely affect the listener's views. This is very important to know what are the reactions to bad news, because we expect these steps through which the listener is going to be passed, and we have to acknowledge each and every step. This is called Kubler-Ross-Grigg cycle. So after listening the bad news, there can be denial, then anger, then depression, bargaining, and finally acceptance. Each listener is going through each of the steps. However, the duration of these steps or intensity of these steps might vary from one person to the other. But the physician should be mentally prepared how to handle these steps. The SPIKES protocol for breaking bad news. This is a very well-known and very popular. So SPIKES: setting, perception, invitation, knowledge, empathy, strategy, and summary. Setting includes privacy, people, and physicians. Yes, we must ensure a calm and attentive environment. We must assess prior understanding of the listener. We must invite questions from the listener or patient. We should transfer the information with prior warning. Yes, we will show you all these basic steps how to follow in the next videos. We must acknowledge and address the emotions. And finally, patient comes to agree on the next steps. Finally, the physician becomes able to convince the patient to accept the news. Some tips of handling the scenarios of breaking bad news. Again, I'm actually repeating the same information so that it creates an impact in your brain, and you don't actually need to think of, well, what I have to do next. So again, introduction, assess prior understanding, that is how much the listener knows about it, then warn, then break the news. Very important, remember, warn and break the news. So you can just tell, I'm afraid it's not going to be good news, or I'm afraid the news is not good, or I'm afraid your father is not in good condition, I'm afraid he's in critical condition. Give her or him some time to absorb it, then break the news. Immediately you break the news, you give a pause. Very important, because whenever we listen about a bad news, in the next few seconds or moments, it's not going to be a smooth activities or interactions in our brains. It takes some time to absorb that unexpected news. We must allow the news to sink, and we must wait for a reaction. There should obviously be some reaction. We should wait for that. We should acknowledge the reaction. We should show empathy at that time. And we should not involve ourselves talking about next steps when the person sitting in front of me is not ready enough to receive the news itself. That is why warning and pause is so important. I repeat, you make prepare the person for the bad news, then you break the news, then give a pause. These three components are most crucial parts of breaking bad news session. Then gradually, when we see that the subject is ready enough, we assess the subject for acceptability of more information. We engage the subject to discuss on the options of treatment. We give the hope, address any concern, summarize, and then close the window. Now we are going to demonstrate a scenario of breaking bad news. So you are about to meet Miss Shima, daughter of Mr. Ujjwal. She wants to know the results of a recent city-guided FNSC test done for Mr. Ujjwal. You know that Mr. Ujjwal was a suspected case of lung cancer. After seeing a highly suspicious shadow in the lung, CT scan was advised, and now the FNSC report confirmed the diagnosis of lung cancer. Your task to break the news to Miss Shima. Shima is the patient's daughter. So this is the scenario.
Hello, good morning. I'm Dr. Farah from Department of Medicine, and may I please confirm you are Miss Shima, right? Yes, I am. And your father is Mr. Ujjwal? Yes. Well, Miss Shima, I've been informed that you would like to know the recent results of Mr. Ujjwal. Yes, please. Yes. The reports are with us now, but Ms. Shima, before we proceed for that, may I know how much you know about Mr. Ujjwal's condition, because that might further help for our next phases of discussion.
Well, my father, he had cough 7 days back, and he told that he saw blood in his cough, and he couldn't eat. He became weak gradually. He could not sleep, and that's when we brought him here.
Yes,
He became very bad.
You are right. The time when we received him, he wasn't in a good condition. The symptoms with which he presented with, we did some initial investigations, some tests, including blood test and X-ray of the chest. You know what's X-ray chest?
Yes.
Yes. The X-ray chest showed a suspicious shadow in the lungs, and which didn't seem to be good to us, so we needed to further proceed for more detailed investigations, and that was CT scan of the chest. Have you heard about it before? Yes, it was more detailed identification of any pathology in the lung. And in that situation, we also arranged to take some specimen, some fluid from that suspicious lesion, and the tissue was examined under the microscope, and that is called CT guided FNAC, and that's what the results are with us now. Yes, we are going to let you know soon.
What is the result?
Shima, I'm afraid the result isn't good.
What is it?
It shows Mr. Ujjwal has lung cancer.
Cancer? How is that even possible?
Shima, I know it's a very tough situation for you.
But is it possible that the report is wrong?
Well, with the situation with which we received Mr. Ujjwal and the findings that we found during his hospital stay, with the tests done before and with the test we received today, we are very much convinced that this is a lung cancer.
But my father, I never saw him even smoke for once. But how did this even happen?
Shima, yes, you are right. There is some association or relationship of smoking with lung cancer, but there is not 100% proof that if a person is smoking, he would definitely develop cancer, or if someone is not smoker, he won't have a cancer. In most of the situations, the exact cause isn't clearly known to us. And I really understand it's very difficult for you to accept the news of lung cancer of your father, and being the healthcare professional, it's also difficult for us to break the news to you. However, what we understand with our previous experience, the soon we can overcome this stage and the soon we can do something better for him.
But how am I going to give the news to him? I cannot give the news to him.
Don't worry, we, the whole medical team, would be with you, and we will assess the condition of Mr. Ujjwal first. So far we have seen him, he's a sensible person. He might like to know what's happening to him, and if we feel that he is mentally capable enough to accept any news, we will try to give it to him face by face, because with the next steps or next investigations we are going to do for him, we might regard his consent. He also might have some plans for it. And to break the news to Mr. Ujjwal, there will be another special arrangement where you will be there, myself will be there, there will be a nurse, and if you want anyone else, will be there as well.
I'd like my mother to be there as well.
Yes, sure. Miss Juma, is there anyone else with you now at this moment?
At this moment, there's no one.
No one. I'm wondering if you are ready enough to discuss more about what we can do next for Mr. Ujjwal. Is it okay for you? Yes, yes. So, Mr. Ujjwal is suffering from lung cancer, but now this is very important for us to assess at which stage of cancer he is now and what can we do for him next. Cancer doesn't mean the end of life. What we are thinking to plan for Mr. Ujjwal is to arrange a medical board next morning where there will be specialists from Department of Oncology, that is the cancer department, and there will be specialists from our own department, so that we can discuss and arrange further plans of investigations and further plans of management for him, what would be best for him. And immediately after the medical board, we are planning to sit with Mr. Ujjwal, you, and if you want your mom as well. But before that, I want the information from you and your mother if you feel Mr. Ujjal is fit enough to discuss about it. Is that okay, Ms. Chuma?
Yes. Is it okay if I give you the decision later?
No problem. You can discuss with your mom as well. I really understand you need some time now to think of it and to discuss with your mom as well. And you can also talk to your father. He was asking about you. Sure. Shiva, is there anything else you would like to know? Or any special?
Isn't there any treatment?
Yes, cancer has treatment. Cancer has different plans of treatment, and that is what we are going to discuss tomorrow morning.
Is he going to be okay?
Well, this is a very tough question because every patient is different and every patient shows different outlooks. So, the question you are asking, we can give you the answer once all the investigations are completed and we are able to know at which stage of cancer he is now. But we are always hopeful. We always have something to do, something to improve his quality of life.
But I would like you doctors to break the news to me.
Yes, we will be there. We will be there to break the news to Mr. Ujjal and talk to him as well. Yes. So I hope you consider yourself to be the team of the management which is treating Mr. Ujjal. Okay, fine. Okay. So do you require any special arrangement?
No, not at the moment.
Not at the moment. Fine. If you want to talk to us, don't hesitate to communicate with us. We will get the extension number of my room and you can call from the helpline number as well. So, thank you very much.
So much.
Now, communication in healthcare in COVID-19 pandemic era. We really understand, considering the current ongoing pandemic, doctor-patient communication has become a very challenging one. COVID-19 has forced to change the approaches of physicians to interact with patients, patients' families, and own team members. From the very beginning, the very look, the spacesuit-like attire creates a barrier between the doctor and patient at first sight. Whoa, what I'm talking to, this look, does it look actually like a normal human? So there is masking of all the nonverbal communications. A simple handshakes that convey this respect and appreciation are no longer practiced. So communication is really, really very challenging nowadays. Of course, we should be concerned about safety of the healthcare workers and the patients. However, use of the personal protective equipments and physical distancing made it difficult to maintain the eye contact, intonation of the voice to express the emotions. See, we are shouting all the time. We are always speaking with a constant loud pitch. So we cannot actually practice the intonation or change in the pitch intensity. And well, we cannot show the facial expressions. We cannot give the nonverbal cues. And it is very difficult and challenging to convey information to differently abled patients. So some strategies of communication in COVID-19 pandemic: communication with the patient, response to verbal emotion with empathic verbal statement, self-introduction at the beginning of every appointment, using the face sheets, inquire about sensory disturbances and arrange assistive device wherever necessary, articulate, enunciate, and increase the volume of speech. Communication with the families and caregiver. This is very important. We should identify one focal person who will receive and disseminate the updates. Consider a video platform for family meetings. We can engage the family and caregivers in developing a patient-centered discharge plan early. And we should assess the patients and caregivers' health literacy and tailor the information accordingly. Communication within the healthcare team. Huddle regularly to review patients' care plans and progress. include the team members working remotely via telephone or secure instant message. Consider automatic consultation from palliative care for appropriate patients whenever necessary. Yes, so this is simply virtual conversion of the video what we showed before. Here, the doctor is communicating with the with Mr. Ujjwal's daughter, that is Miss Shima. So Dr. Farah is communicating with Miss Shima in a virtual platform through Zoom meeting. And now we will see how Dr. Farah is conveying the message of Mr. Ujjwal's lung cancer to Shima in this virtual platform. Yes, internet connectivity and some other issues becomes challenging here. However, there are some rules and regulations of virtual communication. We have to become very cautious about identification of the person whom I am going to talk, and whether she is ready to receive the information, and we cannot express the emotion at that time, so we have to confirm whoever is around her, whoever is around here to support her, etc. and etc. So let's see how it goes on. Hello, good morning.
Hello, good morning.
Hi, I am Dr. Farah, consultant, Department of Medicine. And may I confirm? I'm talking to Miss Shima, right?
Yes, I am.
And Shima, you are daughter of Mr. Ujjwal. Is that information okay?
Yes, I am.
Yes. And Shima, I have been informed that you have booked the appointment to know the recent reports of Mr. Ujjwal. Is that all right?
Yes, I have.
Yes. So, Shima, the recent reports of Mr. Ujjwal is with us now. But before we proceed for that, may I know how far you know about Mr. Ujjwal's condition? Because that might help in further discussion about next plans. Is it okay, Shima?
Yes, it's okay. My father, he started coughing 7 days back, and he also told that he saw blood with his cough, and he couldn't eat. He became weak gradually, and then we took him to the hospital and got him admitted.
Yes, you are right. The time when we received Mr. Ujjwal, he was not in a very good condition. He was suffering from cough. We have seen the blood with cough as well. And we had to do some initial investigations to find out what might be the problem or wrong. And we did the x-ray of the chest. You know about the x-ray chest? Yes.
Yes, I have heard.
Yes, the X-ray of the chest has shown a suspicious shadow in the lungs. It was suspicious, so we had to do some more detailed investigations to find out what might be wrong. And we arranged the CT scan of the chest. Have you heard about CT scan of the chest?
Yes, doctor, I have.
Yes, so it is the more detailed identification of the pathology in the chest. And when this pathology was identified, we arranged to take some tissues from that suspicious lesion. And that tissue was examined under the microscope. And we got that results of what has been found under the microscope, which is called the CT-guided FNSC result. Yes, the results are with us.
What are the results, doctor?
Shima, I'm afraid the result is not good.
Okay. And what is it?
And it shows Mr. Ujjwal has lung cancer.
Cancer? But how is that possible?
Shima.
Is it possible that the reports are wrong?
Shima, I understand it's very hard for you to accept the information. Shima, is there anyone else with you right now?
No, doctor, there's none now.
Shima, are you okay to talk?
Yes, yes, I am. Please
Yes, yes,
continue.
yes. So the findings which we found after examining Mr. Ujjwal and the initial test done and the reports we received and the report we received just now, combining all the findings together, we are very much convinced that Mr. Ujjwal has lung cancer.
But my father, I never saw him even smoke for once, nor did he have any bad habits. How could he have cancer? It's just,
Shima, there is some relationship
how am I
or
going to speak to my
association.
mother?
Shima, are you okay to talk?
Yes, doctor.
Yes,
I'm
yes.
fine.
So, Shima, there is some association or relationship of smoking with lung cancer. However, we cannot 100% confirm that someone who is not smoking won't have a cancer, and someone is smoking, he will definitely have cancer. In most of the cases, the exact cause is not known. And Shima, I understand it's difficult for you or your family to accept the information. And being the healthcare provider, it's also very difficult for us to break the news of cancer to you or your family. However, what we understand with our previous experience, the sooner we can overcome the step of breaking the news, the sooner we can plan for something better for Mr. Ujjwal. And please try to understand, cancer doesn't mean the end of life. We have a lot of things to do.
Yes,
Shima,
doctor.
Shima, I understand there's no one else with you right now, but are you okay enough to discuss further what we can do for Mr. Ujjwal?
I would like to discuss it in presence of my mother also, not alone, please.
Okay, so would you like to have another appointment along with your mother? Is she around now?
Um, at the moment, she's not here. Um, After some time,
All right, all
I
right.
could bring her and
Okay, okay. So we will discuss again maybe after a few minutes, and you can set an appointment with me. At that time, we'll discuss again what could be further done for Mr. Ujjwal and what are the next plans of arrangement of our team. Shima, please don't hesitate to
yes,
communicate with us if you need any sort of assistance or if you
yes,
have
of
any
course.
special concern.
Yes, of course. Thank you so
Yes,
much.
thank you very much, Shima. We'll meet you again. Thank you very much. And that's all. I should acknowledge the doctors who were with me in recording these videos, Dr. Anika, Tasnim Alice, and Dr. Zainab Begum, and Bangladesh Society of Medicine, who have been providing tremendous support since 2017 when I started working with communication skill training. So everything is possible. Everything can be done. I can do it, and it is possible. Thank you very much for your time, presence, and patience.